Hello, my name is Michelle Levine. I'm a nursing student at ECPI Online University. This is Nursing 511, Nursing Theory, and I have chosen to share Florence Nightingale, founder of modern nursing, with you. Florence Nightingale is known as the founder of modern nursing and made many accomplishments through her nursing career, which impacted nursing education and public health. I chose Florence Nightingale because who better to research and share than the one who influenced all of our careers. This is my certificate of original authorship stating that I am the sole author of this paper and PowerPoint presentation. Florence Nightingale was born on May 12, 1820 in Florence, Italy. She was born to William and Fanny Nightingale and named after the city of her birth. She was born into a wealthy family, her father having inherited an estate in Derbyshire, England, and was a wealthy landowner. Florence's parents enjoyed the fruits of their wealth and were active participants in high society. Florence and her sister were raised and tutored by their father and learned many different languages, mathematics, and history. At the time, nursing was considered to be a job for the lower class women, and nurses tended to have the stereotype of being uneducated and having poor morals. Much to her parents' dismay, Florence insisted on studying nursing. She was finally able to convince her parents to allow her to train to be a nurse and moved to attend German nursing school in Kaiserwerth, Germany from 1850 to 1851. In 1853, she became superintendent of a London charity-supported institution that was called the Institution for Sick Gentlewomen in Distressed Circumstances. In 1854, Nightingale organized a group of 38 nurses to go and provide nursing care to injured British soldiers during the Crimean War. Nightingale would walk the wards at night to watch over the injured and the sick and ensure that her patients were doing well. This is how she became known by the British soldiers as the Lady with the Lamp. It was during her studies and work in many different hospitals and during the war that she noticed the poor conditions of the sick and injured and set her mind on working to improve the conditions and thus would see better patient outcomes. Nightingale was one of the first nurses to begin keeping records and looking for evidence that improvements she made would impact the health and healing of her patients. Through Nightingale's experience with the unhygienic and crowded conditions she witnessed in the hospitals and the army barracks, she determined that many soldiers or the sick did very poorly because of the environment. There was crowding of space, lacking of healthy food or clean water, sewage on the floors, and the sick were in dirty and bloody garments and dressings. Nightingale's environmental theory was born out of her thoughts on this. Environmental theory is a patient-centered theory that focuses on the care of the patient rather than the nursing process. Environmental factors affect all patients differently. Nightingale believed that, like the germ theory, a patient must have a healthy environment to heal and maintain good health. She believed the necessary components for a healthy environment included fresh air, pure water, sufficient food supplies, efficient drainage, cleanliness of the patient and the environment, and light, especially sunlight. Her previous experiences in what she felt to be unsanitary conditions impacted the health of her patients, and she felt the nurse's role in caring for the patient was to ensure a healthy environment in which a patient's body could have optimal conditions to heal. If any one of those parts of the equation were lacking, the patient had a lesser chance of healing well. She encouraged nurses to clean and scrub the hospital wards and army barracks, bathe the patients, remove old and stained cloth or used items, and keep the areas ventilated with fresh air. Nightingale made many great achievements in her career as a nurse, theorist, educator, and advocate for patients. She wrote many books and reports regarding the environmental theory and how to improve health outcomes. She was very skilled at math and able to understand the importance of health data in doing research and collecting information. She urged the public officials to collect data on the sick and to note what treatments made improvements on the patients. She's most known for her Notes on Nursing, which was originally published in 1860. There have been some additional revisions. It was a book written to help give hints on ways nurses could help our patients to heal. It included things such as the necessity of sunlight and keeping noise down on the hospital wards, even mentioning that the swish of the nurses' dresses could be noisy and disruptive to patients trying to rest at night. She was able to institute a system of caring for soldiers during the war that cut down on casualties from 48% to 2% in just over 2 years. Her thought was that the conditions of the hospital themselves and the lack of cleanliness and healthy foods and clean water were reasons for the illnesses. In honor of her work during the Crimean War, the British citizens thanked her by funding the Nightingale School for Nurses. Her works and influence have been evident in the nursing profession and education for nearly 160 years. Nurses Day is celebrated around the world on Florence Nightingale's birthday, which is May 12th. Nightingale is known as the founder of modern nursing. The work that she began back in the 19th century has impacted the way nurses care for our patients today. We attend to patients' activities of daily living. We help them achieve a clean, healthy, healing environment. We try to honor quiet time at night or during rest and encourage healthy and nourishing meals and fresh water. Nightingale is a pioneer in nursing education and served as a superintendent at a hospital as well as developed a school for nurses. Nightingale wrote many books, articles, and notes on nursing care and how to best care for our patients. She attended conferences and made presentations to share her knowledge and skills. She was the first to introduce data collection and evidence-based practice in nursing. She encourages nurses to educate other nurses and to support each other in our profession. Nightingale was so esteemed that in 1893, the Hippocratic Oath was reformatted to honor her work, and the Florence Nightingale Pledge was born. This modified Hippocratic Oath was composed in 1893 by Mrs. Lystra Gretter and a committee for the Farrand Training School for Nurses in Detroit, Michigan. It was called the Florence Nightingale Pledge as a token of esteem for the founder of modern nursing. The Florence Nightingale Pledge states, "I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drug. I will do in all my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the presence of my calling. With loyalty, I will endeavor to aid the physician in this work and devote myself to the welfare of those committed to my care." These following 2 pages are my references. This is the end of my PowerPoint presentation. I thank you for your time.